Studio is the Director of Business Development and Client Relation, ODCHC, in the person of Mrs. Aderonke Ibitoye. Good day, it's nice to have you.
Thank you, Mrs. Isosa. Good afternoon.
Yes. How are you doing today?
I'm fine, thank you.
It's nice to have you once again.
Thank you very much.
Yes. Today, we'll be talking about the Southwest Conference of Insurance Agency, and you said this was done during the week. Do you mind telling us what this conference was about?
Yes, thank you, Mrs. Monilari. So last week on the 25th and 26th of June 2025, we had the health insurance agencies across the 6 states in the Southwest, and the conference is just to ensure that we put on the table talks regarding health insurance integration, how we can help our people to access health care services without financial hardship. And the major thing that were discussed during this summit was tailored around integration. How can somebody from Ekiti State access health insurance scheme in Ondo State? How can we from Ondo State access in Ogun State? How can we get strategies in getting informal sector workers? How can we have our formal sector people to be able to access qualitative healthcare services? So the major talks concerning the summit was tailored majorly on health insurance improvements in the country.
For the the Southwest states together and
Exactly.
see how it can integrate and how people in other states can actually benefit healthcare insurance in other states too.
Yes,
okay,
exactly.
so is this working towards, let's say, planning on expanding Oranhis? Let's say, you know, the last time we spoke about how convenient is it for someone to access healthcare if maybe they are not in the Ondo state currently, and let's say they fall sick in Ekiti State or Osun State or other neighboring states. So are we saying that this conference is trying to see how we can integrate or expand Oranhis to other states?
Yeah, thank you. There is a Dawn Commission which is in charge of integration of all the Southwest states.
Okay.
And for us at the health insurance industry, we are interested in ensuring that we have universal health coverage. And for universal health coverage is something that can be achieved when we collaborate together, you know, between states. And for us as Ondo State Contributory Health Commission, the Orange Health Insurance Scheme that has been launched for us for the formal and the informal sector scheme, we have enrollees already, you know, under the schemes. So we are discussing that, okay, how can we have these people to be able to access care in your state, provided they are registered under the Orange Health Insurance Scheme. So it is expanding coverage of health insurance. It is not that people that are not registered, people that are enrolled, because at this point, at this point in time in the country, if you are not under any health insurance, that means the person should go and be arrested. In fact, they need to arrest such a person, because you will see the cost of medical bills.
Yes.
You will see what is happening, you know, in hospitals regarding hospital bills. So for us, we are interested in ensuring that all these people are brought under the safety net of health insurance, and that is what the discussion was you know, about. And also to also have a robust strategy that can be used in driving the expansion of health insurance. And basically what I've said earlier is universal health coverage, to be able to, you know, meet up with covering the residents of each state under the Southwest insurance industry.
Okay, so that means in the future we are hoping that Oranhis is going to expand very soon.
Yes.
Not just to residents in Ondo State, but whether you are in Ekiti or other states, you might still benefit from it.
Yes, provided you are registered under the Orange Health Insurance Scheme of the Ondo State Contributory Health Commission, or any other health insurance agencies like Lagos State, Ogun State, Ekiti, or Osun. In as much someone is registered there, and maybe because of vacation or work calls, and you find yourself in those other states, so you'll be able to access care. And it's just for the states to pay into the cover of that other state's service provider.
Okay, so there's a question that I would really love to ask, looking at the moving away from this, looking at the informal sector. I was going to ask, how flexible is it? Let's say an individual, under the individual plan in informal sector, you first registered under the individual plan informal sector, let's say 18,000 naira. I think that's the premium.
Yes,
and
we
now
have 18, we have 36.
Yes, but I'm focusing on the individual plan.
Okay.
Now, you were a principal enrollee and you registered under the individual plan 18,000 naira, and now you have a family. How easy is it for you to, is there room for upgrade? Is it easy for you to upgrade, and what happens to the money you paid before? How is it being done?
Okay, thank you. For that one is straightforward. The individual plan, for the purpose of people at home, we have the 18,000 individual plan for ages less than 60 years old, and we also have 36,000 naira per policy plan. That is another individual plan, 36,000 for ages above 60 years old.
Yes.
So you can see the dichotomy now. It is age. Individual plan 60 years below, 18,000. Then for aged, 60 years above, 36,000. So for someone that wants to
the family
upgrade,
plan,
it is per policy year.
Okay.
So when you pay 18,000 or 36,000, whichever one is going to expire, then the person buys the family plan.
It has to expire.
Yes, it has to expire.
So what if the person has a family or got married before
along the line? So along the line, the people, I mean maybe the spouse and also the child, can also be registered with the individual plan, and when all these ones expires, then they just switch to the family plan. That is where health insurance is per policy year.
Okay, so that means there is no room for upgrade. If that is what you've paid for, you are going to benefit from that for 1 year. I think that's 12 months.
That's 12 months.
Okay, so after the 12 months expires,
then you just switch to after the expiration, then you switch to the next plan.
Okay, and you talked about the Oranhis T-ship. It's all about the tertiary institution. How is Oranhis bringing them in, and what's the package for them?
Okay, we have students in the tertiary institutions across the state, both government and private institutions.
Okay.
So we have been meeting with some of these institutions to bring these students on board. So very soon, before the end of the year, some of the institutions that gave us their nods will be, onboarded into the scheme. So before the end of the year, our students will be getting admission into the school. So for the new set of admitted students this year, we now be onboarded into the scheme. So the conversation has been that they have a centers in their institutions where they normally go for medical checkups and the likes. So it's just for them to go there, access care, and if there are things they cannot handle, they refer to the next level of care within that local government area. Okay. And if also they cannot do it, it's just for them also to refer to the next level of care from that secondary center, because we have teaching hospitals, we have federal hospitals in the state.
Okay, so what's the premium like for these tertiary institution students?
Yes, thank you very much. The premium is being worked on.
Okay, it's been worked on.
Yes, it's been worked on, and whenever we want to onboard them like that, we onboard them as a group of students of that institution, and this one will be expressly this premium of these students will be expressly stated in the proposal given to the school, so that from there is the premium they are just going to pick, calculate the number of students they have, and premium will be remitted into our accounts.
So it's not going to be charged like individually?
Yes, the premium is going to be charged individually, that is what I'm saying.
Okay.
But it will be expressly stated in their proposals submitted to the school, because we cannot be giving we cannot be collecting premiums per head from each student. We collect it through their school. So that is the idea, because it is the school that will tell us that these are the numbers of students being admitted that they have in the school. We cannot just say that because you are in this compound, it means you are a student here, truly. So we cannot do it that way. So we have to route it through the school. So the premium is being given to the school. The premium work is what the school will use to calculate the number of students they have, multiplied by the premium, then remitted into our
okay,
accounts.
so there won't be any age restriction as long as you can show that you're a member or a student of that school. I think maybe with your ID card and all of that, then you are entitled for this Oranhis T-ship.
It's just like group insurance.
Okay.
You know, our associations and cooperative societies that we have been talking with, we have been encouraging them that they come as a group.
Okay.
And it is the ESCOs of these associations that we identify these people as part of their members. So just like that is what is going to happen also in our schools.
Okay.
It is the school authority that will give us the list of students that they have in their school.
Okay.
Before we onboard them into the scheme, and they might have even paid their premiums to us before putting them in different facilities. Before onboarding them into the list of enrollees of their health facility within the institution.
Okay, so in other words, there is no age restrictions.
Provided they are students in that school.
Okay, now that brings me to the question, what's now the difference between the Oranhis T-ship and the individual plan under the informal sector?
Okay, thank you very much. We said we have, like what I've been explaining earlier, for individuals that are not students of any school. Okay. We refer to those ones as Oranhis informal sector group of health insurance. Then we now have this T-ship, student health insurance program for students in higher institutions. That's just the difference. And why we have a different type of premium is because these students are not they are not like the regular people that are working outside. They are students. Somebody is taking care of them, and they are being, they are under the tutelage of a guardian or their parents. So it is their parents that are not civil servants or do not take salary from the government payroll that falls under the caveats of Orange Health Insurance Informal.
Okay, so can you tell us the benefits for this Oranhis T-ship? Because now you said there's no much difference. So what are the benefits? And I'm sure there would also be a slight difference in their premium, because you just said that they are under they're still under their guardians or parents. So obviously there is going to be a sort of maybe reduction. So what are other benefits that the students under the Oranhis T-ships are going to benefit?
Yeah, thank you. The benefits package, that is the services enlisted under the T-ship plan, it's a little bit different from what we have in the Oranhis formal and the informal sector. You will agree with me that students are just set of people under institution, tutelage, still being encouraged to learn. So maternity services, for example,
it's out of it.
It's out of it.
But then, there are some students that are